My name is Dion Davis. I've tried to live my life with no regrets, but I guess my final regret is not getting vaccinated. Please, don't let not getting vaxxed be your final regret.
Hello, hello, hello. Welcome back, Be Health Empowered family, to another episode of Excuse Me, Doctor. And welcome to 2022. This is our first show back. And I know, first of all, I can't not talk about that video that you just saw. That was produced by the Be Health Empowered group and the Duran group, a powerful, powerful piece uh, talking about, regrets about people not getting vaccinated. There's a longer version that ends much more positively if you're interested, located at vaxnowga.org. But before we get into all that, I just want to welcome you all back. I mean, last time that we spoke, it was back in, mid-December, and things were a lot different. Omicron had just gotten here, and we are 3 weeks later, and the world has been once again transformed. And so we're back. We're back to answer your questions tonight with our producer show. We're rested, we're revamped, we're ready to go. And I know you guys have lots of questions about Omicron, about health topics, and we are here for all of it. So thank you, thank you, thank you so much for joining us. Thank you to our newbies who it's their first time watching Excuse Me, Doctor. And if this is your first time, please remember to hit subscribe if you're on YouTube. And if you're on Facebook, please make sure to hit that like button. Really appreciate you for it. We are here each and every week on Excuse Me, Doctor, just to make sure that you have the facts and the evidence to be able to make informed decisions for you, your family, and indeed your whole community. Because we are in this together, y'all. And we want to make sure that you have what you need, that you're equipped to be health empowered. So thank you for joining us. And I hope that you share right now this episode, because we're going to be getting into it. And I want to make sure everybody has a chance to get all your questions in and get them answered. So start putting those questions in right now. And you know what time it is. Right now, it is time for me to welcome back my incredible co-hosts, Miss Lila Mays, coming in from the West Coast, and Mr. Wayne Bruce.
Hey, Happy New Year, y'all.
Howdy.
Happy New Year. I am so glad y'all are here with me.
Hey, I'm
glad to be here.
I am.
Yes.
Lila, I'm
absolutely
glad to see Lila. Look at Lila, y'all.
I know. Look at those locks. Look at those locks getting all long.
Rocking her twisties. See
her locks. Her locks.
Locks. I was the only one rocking twisties, right? Because I was commitment anxiety.
All right.
I had commitment anxiety. I'm sorry.
You gotta speak up, because
we
gotta make sure we hear everything you say, Wayne Bruce. Now we can.
Can you hear me? I gotta talk into the mic.
All right.
Let me just say, studio is on fire in here. I mean, this thing is not cooperating tonight, so bear with us a little bit. All right. As you can see, I'm moving right now.
All right. Well, we're going to make it happen. And the most important thing is that, we're not going to have any guests tonight because it's a producer show, right? But we're going to have our audience as our guest. And so we want you to put your questions, your comments, your concerns, everything going on with you that you want to know about this Omicron variant. And right now, while you're getting that together, we are going to go into our weekly recap. So what do we have? We got the numbers, right? So I was saying, when we left off in mid-December, y'all, we had just reached around 50 million COVID cases, and we were diagnosing around 165,000 cases a day, which was off the chain. Now, with the Omicron variant, Omicron has blown that out the water. So we're adding new cases, 800,000 new cases a day. I mean, that's like what, 5 times what it was?
That's crazy.
Yeah, and we have surpassed 60 million cases. We added 10 million cases in like 3 weeks. It's unbelievable. And the new case count is meaningless because I can't tell you how many people I know personally who've said, "Oh, I'm pretty sure I have COVID, and I'm not
Right.
trying to stand in line for those tests."
Right.
Exactly. No, that's real.
Look, hey,
Yeah.
I'm a cat. I have not had COVID, but I actually waited in line for 5 hours.
Wow.
5 hours in my
Yeah.
car.
Yeah.
And
Yep.
luckily the police officer let me get out to go, handle my business and come back after I did that and bought snacks. Because he said from
Yeah.
this point on, it's another. I have waited 3 hours. He said from this point
Right.
on, it's another 2 hours. I was like, dude, I can't hold this for another 2 hours.
And that was all to make sure that you were safe as we welcome family to get together for Christmas.
Yeah.
We required everybody to get a PCR test, so we had to live up to our end of the bargain and make sure we got it too.
Come on,
And so,
Dr.
yeah.
Mel. Come on, Dr. Mel, with the
Yeah, that was
mandates
a
at the
mic is
house.
5-hour
They're
thing.
saying my mic is weak. I'm going to talk down into it. It's going to look.
That's better.
It's going to look crazy on the screen.
Yeah, no, that's better though.
That's better.
Yeah, that is better. Yeah.
Listen, Omicron is wearing us out. It's wearing out our
It's wearing
internet
us out.
connection. It's wearing out our mics, our cameras. Y'all bear with us
Right.
tonight.
Omicron
Right.
is working us day and night.
Yes.
Serious.
Sheesh.
And so the other thing Omicron is doing is pushing up hospitalizations and cases among children. So children now make up 15% of all reported cases in the United States. 325,000 new cases just added for children just in the past week. And hospitalizations have doubled for everybody, including children. So we went from 58,000 total hospitalizations for everybody up to about 115,000 now. And children are still less likely to be hospitalized than adults. But between September and December, in September, adults got hospitalized roughly 50 times more than children. Now it's down to only 30 times more than children. So unfortunately, we're seeing Omicron affecting kids more and more.
And Dr. Mel, is that kids who are too young to be vaccinated, or do we have an age range on those kids?
It's mainly kids too young to be vaccinated. But remember, even for the 5 to 12-year-olds, only a quarter of them are vaccinated. So, it's affecting them too. Yeah, unfortunately.
Wow.
And then that brings us to our vax facts. And let me just mention with deaths, the only silver lining is deaths are holding steady, which is still terrible. That means that there are 1,500 to 2,000 deaths a day. But that figure has not been increasing at the same rate that we've seen hospitalizations and cases increasing. So that speaks to the fact that Omicron is a little bit more mild, and the fact that the vaccine is protective. It's protecting against death.
It's so interesting because I think that's a great distinction. It is highly, highly contagious, but a little more mild in
the
symptoms appears to be. Yeah.
Correct.
Okay.
Yep. And then, we're at 66.5% of everybody over 5 being vaccinated.
Wow.
So that's fully vaccinated, but I think this is a good place to talk about fully vaxxed and fully protected are not necessarily the same thing, right? Fully protected means being boosted. Is there any more any new information about the booster in light of this Omicron situation?
Yeah, absolutely. So fully vaccinated means 2 doses of a messenger RNA vaccine, so Pfizer or Moderna, or 1 dose of the J&J. But we know from like a few months ago that we're now recommending that people get boosted an additional dose on top of that. So who's eligible? Just recently, they dropped the eligibility down to 12 years old. So anybody who's 12 years or older can get their booster their booster of Pfizer 5 months after their second dose of the Pfizer vaccine. Anybody who's 18 or older can get their Pfizer or Moderna 5 months after their second dose. And if they got the J&J, if they're 18 and older, they can get it 2 months after the J&J. And you can mix and match. It doesn't matter if you got Pfizer or Moderna, you can, boost up with either one. Or if you got the J&J, you can boost up with either Pfizer or Moderna.
Let me tell y'all, I'm gonna be walking around here like Pinhead, okay? Because any booster they giving out, I'm taking it. That's Lila. I'm taking all the shots.
Yes. Yeah, because compared to last year in terms of hospitalizations with the number of cases, we're way fewer hospitalizations than you would expect for the number of cases. And a lot of that does have to do with how vaccinated we are and the number of people, especially the vulnerable people who've gotten boosted.
Okay.
Wow. That's great.
Yeah. So that's the numbers.
All right. Those are the numbers. Moving on. Treating obesity, this message for me, appears protective against severe COVID. Get your tail up and walk and be healthy. And
well, we're gonna do a whole episode on obesity, and obesity is a disease. It's not just there's not just a simple fix, right? But this study was actually done in patients who had weight loss surgery, right? So they looked at 12,000 obese patients who had weight loss surgery. They lost on average about 20% more body weight than people who they were exactly matched to, but who didn't get the surgery, right? And then within the study, 800 people out of that 12,000 got COVID during the first year of the pandemic. And they saw that those people who had undergone the surgery had about 50% less risk of hospitalization, 63% reduced need for supplemental oxygen, and a 60% lower risk of death or getting on a ventilator due to COVID compared to the people who had not had the weight loss surgery.
Wow. Interesting.
So that says, because this is, again, these are the super obese people who are eligible for weight loss surgery. So just to be clear, but clearly improving your BMI, meaning losing weight, does have some protection against severe COVID. And that's really important. We already knew that obesity was a risk factor. This study just underscores that in terms of our need to maximize our health in terms of our weight.
Okay. In that vein, is junk food making us more angry?
Well, if you have them flaming hot Cheetos, you're going to be mad.
Right.
I'm sorry I'm laughing, but when I saw this, it tickled me.
Yeah. Well, this is the answer real. Actually seems to be yes.
Yes.
And that's because micronutrients, right, that are in whole foods, things that are not processed. So like fruit and vegetables and whole grains, they provide our brain with crucial nutrition, right? And there's a growing body of evidence that if you're not getting those micronutrients, it's tied to poor mental health. And so they've done studies in a bunch of different countries, and it shows that people who eat a diet that's rich in ultra processed foods that lack vitamins and minerals, they are having these higher rates of poor mood control, irritability, angry outbursts, and even suicidal thinking. And that's compared to people who eat whole food diets like the Mediterranean diet. What's the Mediterranean diet? That's the diet that's rich in fruits and vegetables, beans, and peas, unsaturated fats like vegetable oils or oils derived from vegetables like coconut oil and avocado, and that it's low in processed foods and red meats.
Mhm.
So that's really important. And this blew me out of the water. 57 Americans consume 57% of their calories from ultra processed food sources. And for kids, American kids, it's even worse. 2/3 of all their calories come from ultra processed food sources.
Wow.
Yeah.
So, yeah,
It's easy. It's fast.
You know,
but
and in poor
yeah.
communities, that's even greater, isn't it?
Sure.
absolutely. Yes. People that live in food deserts that don't have access to fresh fruits and well, fresh produce
Mhm.
are at a higher risk, even more.
And since this is a producer show, we have one of our guest audience members watching us. Pebbles Brown says junk food are inflammatory triggers too. She believes, right?
That's exactly right. So it's a double whammy.
Way to
You're
go,
getting
Pebbles.
inflammation, unhealthy inflammation in your body, plus you're lacking the nutrition that your brain needs to function that leads to these changes in mood and changes in brain function. Yep,
Right.
absolutely so.
Yeah.
Speaking of just, being mad, a lot of people don't like to wake up and they get into this food and sleep cycle, this vicious cycle of being tired but not realizing they're sleepy and they want to eat.
Right. That's correct. And so what they saw is that certain diets promote healthy sleep. So more than 7 hours uninterrupted sleep. The Mediterranean diet was the leading one. So plug in the
Mhm.
Mediterranean diet. And the flip side is that if you miss out on sleep and only get about 4 hours sleep for 4 nights in a row, you start to eat more because you're tired, and you
Sure.
get in, on average, you're getting 300 plus calories more a day when you lose out on sleep. And it's thought that this is due to alterations in your hormones that happen when you have lack of sleep. And those hormones are the ones that control your sense of feeling full. And so if you're not feeling full, what do? You eat. So therefore, a
Mhm.
healthy diet helps us to sleep better, the Mediterranean diet, and better sleep helps us to eat a healthier diet. So they work together.
There they go.
Eat better, sleep better.
Eat better,
Yeah.
sleep better.
Sleep better, eat better.
There you
Same
go.
difference.
It's a vicious cycle.
It's a vicious
It
cycle.
is. All right. Cataract removal and brain health. I find this completely fascinating because there are benefits to cataract removal beyond vision stuff. Yeah, Dr. Mel?
Correct. And, this is for our older audience members, or if you care for an older audience member, this is really key information to know. So they
Mhm.
looked at over 3,000 seniors over a 10-year period, and they saw that those people who had cataract surgery were 30% less likely to develop dementia. That includes Alzheimer's. And that's as compared to people with cataracts who did not have the surgery, right? And it's thought that it's because when you have poorer vision, it leads to social isolation. You're less likely to get out there and do the things that you used to do or drive, etc. And that social isolation leads to lack of stimulation of your brain, which causes your
Okay.
brain function to go down, which leads to dementia. So by restoring people's vision, it restores
Mhm.
their confidence and getting back out there interacting and
Wow.
being more social, and so therefore staves off dementia longer or period.
Wow.
That's great.
That
That's
is
incredible.
a hearty piece of information. That's really great to know.
So I mean,
Okay.
Dr. Mill, I know and you and Lila didn't know her, but my grandmother used to say, I'm getting my cataracts removed. And I used to wonder as a child, she
What
had to
is
get my
that?
cataracts. And she come
And
back. She came back. I remember coming back with the patches over her eyes and everything.
yeah,
And she was clear until her death.
you know,
Maybe I helped.
I was gonna say, I'm really glad that you brought that up because a lot of people don't know what cataracts are. So let me just say,
Right,
cata-
right.
cataract. So we inside of our eyes, we have a lens, and that lens is the light goes through our lens, and it magnifies and hits the back of our eye. Now, if our lens gets cloudy, which tends to happen with age, just imagine looking through a cloudy glass. You can't see anything, and that's what a cataract is. It's a hardening of the lens, so that it
Okay.
Uh-oh.
Uh-oh. Okay. So
She'll be
see
back.
part.
sort of fake lens in there.
Okay. See.
It allows people to see better. So
Okay.
that's what a cataract is,
All
and
right.
what
All right.
cataract
So
surgery
Dr.
entails.
Mel, you are freezing a little bit, but I guess it's catching up. Don't. Dr. Mel, we can still see you. So,
can you hear us,
can
Mel?
you hear us, Dr. Mel? She cannot. Did somebody? Okay.
Okay, she'll be back.
She'll
Well,
be
I want to
back.
say this. Listen, it's the top of the year.
Mm-hmm.
Go get your vision checked. I
Go
get my
get your
vision
vision
checked
check. Really, go
once
get
a
your vision check.
year. January is a great month to do that for
Right.
benefits that kick in top of the year. Go get your vision checked.
And I just want to let everybody know Lila is a pro. That's why she jumped in and said, "Go get your
Listen,
vision check."
I'm the glasses chick. I am.
Right. If y'all
Yeah.
come back next week and the week after, she have a new set of
Might have
glasses.
on a different pair of glasses. Yeah.
Right.
Exactly.
You know, I think we take our vision for granted until we don't have it.
Yeah.
And I
Right,
know I
right.
definitely did until I had a medical incident where I actually lost my vision. And
Mhm.
It was scary.
it was very scary to say, you know, I lost it only in one eye, which is scarier, you know.
Mhm.
And praise God, it was not anything you know, like a stroke or
Mm,
anything.
right.
But I mean, the situation was incredible and very scary, and I have my vision checked regularly now. And
Yeah.
you know, just go get your vision checked. And uh you know, we have one of the guests who just wrote about junk food, and they're very unhappy that junk food makes them angry. Shout out to
Sorry.
Asha Anderson. Wow, junk food makes us more angry. Yes, it does,
Those
Asha.
those hot flaming Cheetos, especially.
The flaming hot Cheetos, the
Especially.
flaming hot
Yeah.
Cheetos will
Especially.
get you.
Right. So that was our weekly recap. Thanks for jumping in there, guys. I am back. And what time is it now?
The
Wayne?
weekly debunk.
You know what time it is.
Stopping misinformation in its tracks.
Listen, this week, Tanisha Twitterfinger says so many people are saying, and I agree, that getting vaccinated is a 100% personal decision. My body, my choice is not limited to Roe versus Wade. I'm just saying.
I don't know, Tanisha. Excuse me, Dr. Mel, is that true?
No, it is not. So this actually has personal meaning to me. Vaccination is a decision that each person makes for themselves, but it is not solely a personal decision. Personal means that it relates to an individual human being, not the public. But just like drunk driving is a personal decision until you hit somebody, in a public health emergency, you can't have a purely personal decision. And here's why. As we speak right now, my father in law, who I love dearly, is in the hospital. He broke his hip, unfortunately. He can't get a physical therapist to come see him every day because there's a shortage of physical therapists because they are dealing with COVID patients. He can't get a speech therapist that he needs to come see him in the hospital because they're dealing with COVID patients. His nurse that should only be taking care of 2 patients because he's in an ICU is having to care for 4 patients, one of them a COVID patient. So that person, she or he, the nurse, is constantly in and out of that COVID patient's room and coming to see my father-in-law, increasing his risk for getting COVID.
Yeah.
And most of the people who are in the hospital are unvaccinated. One of the reasons that our hospitals have been overrun, 1 in 4 hospitals are overrun and on short staff right now, is because there's so many people that are unvaccinated and getting COVID. So their personal decision is affecting my father-in-law right now. And sure, both unvaccinated and vaccinated people get COVID. I get that. But that's like saying me and Tiger Woods both play golf. I play golf, but he is the greatest of all time. And I don't shoot less than 100 when I play. Okay. For the people who are not golfers, I suck. So unvaccinated people pass COVID on more often, 2 to 3 times more often than those who are vaccinated. They get hospitalized more, 10 to 13 times more. And unfortunately, they die more often, 15 times more than those who are vaccinated. And then as far as that abortion analogy with the my body, my choice, that's the most inaccurate analogy possible. And this is why. An infectious disease is not like a fetus. A fertilized egg originates in a woman's body. It only requires that body to survive, and it doesn't get spread around. A virus, on the other hand, originates outside somebody's body and can only survive by being passed on to others. Hence, the decision to not wear a mask or not get vaccinated or not social distance is a group decision that an individual makes, but it is not a personal decision.
Absolutely. It affects
I'm done.
community. Yeah. All
So,
right.
That was our weekly
That was,
debunk.
in the words of Spike Lee, that's the truth, Ruth.
Yes.
Yeah. So,
all right.
Let's see what we got here.
Well, I think we can just move on into our producer show with our audience as
There
our
we go.
guest.
There we go.
And
I'm
so,
excited.
what are you seeing in the chat, Lila? What you got up on board? We are going to jump right into answering questions and hearing comments and concerns about Omicron. We'll talk about the new variants, right? Like Deltacron, which sounds like a transformer, right? But
good grief.
It's
what it is, though. It's a transformer. That's what
it's a transformer.
What it is.
Yeah,
A transformer.
It's a transformer.
Let me go back. We had a very early question. Did you see that, Lila?
No, I haven't been following questions. But while you look, I have one.
All right, go ahead.
Okay.
So, Dr. Mel, I've been theorizing with my lack of a medical degree. Do we think that because Omicron is so contagious, so many people are getting it? Literally, I've said this before, I work in entertainment. 70 cases here, 50 cases there, 40 cases. These are in productions in LA. It's bananas. Coming back after the holidays, so many COVID cases are positive. Is there a possibility that because it's so contagious, this may actually be the way to herd immunity?
No, I don't believe so, because what we're seeing with Omicron is that if you had Delta, that doesn't protect you against getting an Omicron infection.
Mm-hmm.
So we don't know what the next variant is going to be.
Okay.
We don't know, in case you're tempted to say, okay, I'm gonna go out and just get me Omicron, right? Because I think it's mild and that's a good way to get immunity. We don't know if the next variant coming down the line will supersede Omicron and evade whatever antibodies your body produced against Omicron. We do know that Omicron protects against Delta, but Delta is basically gone now. I mean, 95% of the new cases are Omicron. So Delta's probably not coming back. What will come in the future will be some new variant. The second thing is, remember long COVID? You know, we had long COVID with Delta. We've had long COVID with all the other variants. There's no reason to believe that there might not be long COVID with Omicron. So again, you're taking your Russian roulette chances by getting Omicron, especially if you're unvaccinated. And even for vaccinated people, again, vaccinated people can get long COVID. It's much, 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 much less common than unvaccinated people who get COVID, getting long COVID, but it's still possible. So I still think that the best course of action is to protect yourself as much as possible from getting infected.
Okay. I have a question from Michelle Walker Scales. Does the vaccine protect us from future variants? Is there any way to know that?
So what we are seeing, and hi Michelle, Happy New Year. What we're seeing is that the vaccine protects us not as well against infection with Omicron, but it protects us against hospitalization, severe COVID, and death from Omicron. And if you're boosted, that protection is even higher than if you just have 2 doses, right? Pfizer is currently working on an Omicron specific vaccine. They don't know if it's going to be needed because right now the available vaccines, again, it's not preventing people from getting Omicron as well, but it is protecting them. And so we don't know down the line, again, nobody predicted exactly how Omicron would behave. A year ago, nobody predicted how Delta would behave. A variant is, we don't know what each variant is going to look like. So it's kind of impossible to say right now. What we do know right now is that the current vaccines are protecting still against severe COVID and death.
Okay. Wayne, I have one more thing.
Go ahead.
So Dr. Mel, can you distinguish if there are any distinguishments to be made, symptoms from COVID-19, Delta, and Omicron? Because it sounds like they're not all the same. Can you give us a little breakdown?
Yeah. So Omicron appears to affect the upper airway more than it affects the lower airway. What does that mean in terms of symptoms? And whereas the opposite was true of Delta. So Delta tended to make people sicker because they got more instances of COVID pneumonia because it was down in the lungs. With Omicron, what we're seeing is more sore throats, more earaches, more runny nose. In children who have narrower airways in their neck, the part of the airway that's in the neck, when it gets inflamed, they make a sound that sounds like a seal, and that is called a croupy cough. You may have heard of kids with croup. So Omicron does seem to produce this sort of seal-like bark.
What does it sound like, Dr. Mill?
Do not do that.
Okay. I can't. It sounds like a bark.
Immortalized on the
It sounds like a barking cough. So that's what we're seeing more in kids. And then the other key difference is I've heard a number of people say, well, I have COVID and I had runny nose, but I didn't lose my smell and my sense of taste. Well, Omicron doesn't appear to do that as much as Delta did. So we're seeing people who just seem like they may have a cold or a flu type, regular cold, regular flu type symptoms with Omicron.
Okay. We have a question from Kanisha Yates. She says, good evening. Is the J&J vaccine and booster working against Omicron?
Great question. So just like with Delta, with Moderna and Pfizer, it does seem like Moderna and Pfizer is working a little bit better than the J&J. But a lot of people who got the first J&J have gotten boosted, or their second dose, I should say, their second dose with a messenger RNA virus. So I think that, they're still looking at the data on that. Remember, we're sort of only less than a month into this. So the final results still are outstanding.
Okay.
Okay.
And we have
You got
another
it, Wayne?
one from Nat and Wash. She says, or he says, I can't see from here. I've had COVID twice. Is it possible to get it a third time? I'm worn out, fully vaccinated and boosted.
Hi, Nat. So yes, it is. If you, especially if the second time you had Delta, it's still possible for you to get Omicron. And like I said, we don't know what the variants are coming down the pike. What I would probably say is be very vigilant in terms of who you go around. Be very vigilant about your mask wearing and social distancing. I would also say maximize your health as well. And in addition to getting vaccinated, make sure you're getting all those micronutrients, your vitamins and minerals from a healthy diet. Um, you know, walk, you know, move. I was going to say exercise, but make sure you're getting enough movement, enough sleep every day. I found that, pre-COVID, the way that I would know that I wasn't getting enough sleep is I would get a cold. That would tell me my body was run down. So if you find that you're getting COVID a lot, and you're still doing all the other precautions, maybe it's also making sure you're taking good enough care of yourself to make sure that your health is maximized.
Wow.
Absolutely. I have who was that? Nat? I have a friend, Nat, who's had it 3 times as well, fully protected, fully vaccinated.
Mhm.
And they've had it 3 times.
Right. But I would say, I would hope that none of those times that you had it, that you ended up in the hospital, because the whole point of the vaccines, again, are to
Right.
prevent hospitalization and to prevent severe COVID. So hopefully, at least if you got it, it wasn't a severe case.
Sandra Hawkins Beard had a question. She said her mom got vaccinated today and seems to have a headache and feels really tired. Is this normal after being vaccinated? And before Dr. Mel answers, I'm gonna say yes, because those were my symptoms after my booster, a headache
Yeah.
and fatigue.
Yes.
Mel.
And Lila is 100% right. Congrats to your mom for getting vaccinated. Tell her to stay well hydrated, get some rest. If she's not allergic to Tylenol, or has no reason to not take Tylenol, that's a possibility. If she has a fever, but it's commonplace, especially for people under age 55, to get body aches, to get fevers, to get fatigue. Um, and if you have those for more than 72 hours, you definitely need to seek medical attention. But if it's less than 72 hours, that's sort of anywhere from 1 to 3 days is sort of the average length of time that those symptoms happen after vaccination.
Wow.
And they're more common after the second dose, or with the
Mhm.
booster.
Mhm.
Of course, Sandra, shout out to your mom. I had none of those things. I just went to sleep.
Yeah, whatever.
Okay. So we have a question coming from Deborah Berry. Happy New Year, Doctor. Could you explain the differences between the KN95 and the N95s? And are we protected if we rely on the N95s, especially on planes and other public places?
Great question, Deborah. Happy New Year. So there's really no major difference between the KN95s and the N95s. The biggest difference is that the N95 can actually be custom fitted to your face, right?
Mhm.
So that you get a better seal. And that's why it's the preferred mask to be used in healthcare settings where healthcare workers have a higher exposure to COVID-19. But for purposes of the public, N95 and KN95 are pretty much interchangeable. Where you really need to be concerned about is cloth masks. So cloth masks have come to be a fashion statement, right? So I know a lot of people don't want to give up their cloth masks, but cloth masks definitely do not work as well as KN95s and N95s. And even the 3-ply surgical masks work better than the cloth masks. So if you are committed to your cloth mask because you like how it looks and you have like the little blingy ones and all the ones that say the cute little phrases on them, I love them too. What you need to do is you need to double mask with a surgical mask underneath or a KN95 underneath, and then your cloth mask on the outside. And if it's a surgical mask that you have underneath, it's good to put a filter between the surgical mask and the cloth mask. And that filter can be a paper towel. It can be one of those blue shop rags. Help me out, Wayne. What are they called?
Shop towels.
Shop towels. Thank you. You could use that as a filter. But that's the way to make it almost as effective as a KN95.
Yeah, they real cute, and I like cute, but
yeah, but I'm sure you like being safe more.
Yeah, I gave up the cloth mask in 2020, and
right.
But I think these are great questions, y'all, and great information, because it feels like we're going backwards, like we're traveling in time and going back to when we were having all these surges. And so I think it's really important for us to share information. I was in a car accident just before Christmas, and so I have to see the chiropractor a couple times a week now. And I'm laying on the table for an hour, double masked, damn near in PPE. If I could be fully clothed for my deep tissue massages, I would be. But I'm definitely double masking, and I wear the mask I'm supposed to wear, but I'm scared of COVID. So
yeah,
right.
So
I don't blame you.
So we have a question from Winter and a statement from Winters Lori. Winters Lori says, I double mask. The surgical masks have caused a major acne breakout. And Winters said, is it true that COVID patients are being treated with doxycycline?
So regarding the mask, you might want to just consider trying other masks apart from the surgical mask. And I've heard that as an issue with other people complaining about the surgical mask. Try a KN95, try a N95 as another option. Maybe also, if none of those work, maybe wearing a cloth mask against your skin and then the surgical mask on the outside might also be another solution. And then the other question I think you had was doxycycline. I haven't seen any evidence about doxycycline. What I've seen is that an antidepressant called fluvoxamine has been shown to have some effect. They have not presented the data to the FDA yet, but there is talk that is being used and is effective in preliminary trials. So look for that to be vetted with the FDA in the near future. Doxycycline, I have not heard that.
It's an antibiotic, right?
Yeah, doxycycline is an antibiotic, which typically antibiotics are used to treat bacterial infections.
Right. That's so exactly why I said that.
Right. Yeah. So a lot of times what you might hear is that people get admitted to the hospital with COVID or being treated as an outpatient for COVID. They get put on an antibiotic, but I don't think it's necessary. It's more in case there's a bacterial infection on top of the COVID pneumonia, as opposed to the antibiotic is actually treating the COVID.
Okay. Yvonne Smith, our homegirl.
Hi, Yvonne.
She's had a bunch of comments, but she said something that just really resonated with me. She has two comments that I want to address. One was that I think this was you, Yvonne. One was, so many people are out sick. She has to wait 5 days for her grocery order. That sucks. The other thing, not fun. And then, and I feel your pain because I'm having the same kind of issues. The other thing she said was, now I can't find it, but I think she said she's going to dedicate her, there it
Her
is.
mask,
She-
her cloth
she's going to
mask
dedicate her mask to
to
quilts.
quilts.
Yeah.
I was going to do that.
I didn't hear, she's gonna dedicate her mask to what?
Her cloth
Her
mask
cloth masks to
will
quilt.
be
She's going to
dedicated
quilt
to
with
quilts
them.
in the future.
Yeah,
That's funny.
that was funny.
That's a good one. That's
So
a good one.
we have a lot of school questions, and one actually comes from a student. I recognized this one before because they were the flaming hot Cheetos person, and it comes from Asha Anderson. What are some
Hi,
of the
Asha.
Hey Asha, what are some of the precautions college students should take while being on campus and while taking in-person classes? And a lot of people just want to know, do you think it's safe to go back to school in school settings?
Well, safe depends on, everybody involved. And I know that universities are requiring vaccinations, some are requiring boosters, so that helps. They're decreasing the number of people that you interact with in your dorm room in terms of, how many roommates you have. So that's one layer of protection. And as far as many universities are requiring weekly tests so that they can best do contact tracing, that's another layer of protection. But then, you know, the behavior of students is sometimes very difficult in a college setting to really wrap your head around, and in terms of making sure everybody's wearing masks, making sure everybody's social distancing, if there are activities going on, that they're done outside, and that in the classroom, again, there's adequate ventilation, adequate social distancing, and adequate mask wearing. Those are really the ingredients for safety. It's easier to control in an elementary school setting because you're controlling, younger children take direction better. It then becomes a little bit more difficult to do in a high school setting because older teenagers are less likely to take direction. And then when you get to college, it's even more difficult to control, because then there's a lot of interaction between the students and where they live. They live out in the community oftentimes, and so go back and forth between the community and campus. So I don't know if that answers your question, but they're the elements that can allow for safe interaction. They just have to be followed. That's really the key.
Dr. Mel, there was a question. I know we must be in the lightning round. I know we have very few minutes left, but okay, we have
a few.
I saw a question, Dr. Mel, is the Omicron variant affecting surgeries? Like, are we back to
Yes.
that? Okay.
Yes. So if you all heard the weekly debunk, and I mentioned about my father-in-law being in the hospital and hospitals being short-staffed across the country, what's happening is they're having to cancel elective procedures. So people who required back surgery because their back hurt, all kinds of elective procedures are being canceled because they just don't have the personnel to do them. They have to keep that personnel there for the extreme emergencies and to take care of the multiple people who are ending up in the hospital with COVID. So yes, a lot of stuff is getting canceled, and it's in the hospital, but it's across all industries, from grocery delivery to transportation, the metro and airplanes and deliveries, all kinds of things are being affected because we're basically in a nationwide sick out.
Yeah. Wow.
And
Yeah.
when you put it in that perspective, that we're actually in a nationwide sick out. Like
Yeah.
the whole entire nation is participating.
Yeah. And it's probably going to go on at least till the beginning of February is what it's looking like. So
Yeah.
strap up and everybody be safe out there. I want to thank my audience. Y'all were wonderful guests, great questions. Thank you so much. Thank you to my fabulous co-hosts and producers, Mr. Wayne Bruce and Miss Lila Mays. I want to take the last couple minutes just to talk about a special opportunity that I want my audience to be aware of. And that's the opportunity to participate in a Howard University research study. They have asked me, the Research Centers and Minority Institutions Community Engagement Team, that's the name of the team at Howard that's doing this. They've asked me to invite people who listen to my show and have engaged with me to participate in a COVID resilience research study. So understanding how is everybody out there coping with the challenges that COVID is bringing. Participation in the study is totally voluntary. And if you choose to participate, you'll be asked to fill out a 2-part survey after you go through a consent session. So if you have any interest, please just indicate so in the chat. And the research assistant, Dana Harvey, will be reaching out to you to schedule a time where she can discuss the study with you. Everyone who, if participates, will be able to be reimbursed per survey $50. So 2 surveys up to $100 by participating. So if you have any inclination, again, please just indicate in the chat, and then the research associate will reach out to you to get your consent and send you the link to send out the surveys. It's pretty easy. All right. So thank you all so much for joining me. I will see you right here next week, Monday night. In the meantime, you can hear me tomorrow morning on the Russ Parr Morning Show at 7:45. And I want you to not just be safe, but be wise, be well, and be health empowered. Thanks so much for joining.
My name is Dion Davis. I've tried to live my life with no regrets, but I guess my final regret is not getting vaccinated. Please, don't let not getting vaxxed be your final